My name is Rachel Leitsinger. I'm in NRP413. This is my physical assessment video. I'll be assessing Zach. He is 23 years old with osteogenesis imperfecta. It has limited his mobility and his range of motion. He uses a wheelchair and has some scoliosis as well. He appears well nourished and is appropriate in behavior. First thing I'm going to do, Zach, in our physical assessment is inspect your skin.
Okay.
All right. So I'm just looking for any redness or rashes. You do have a little spot on your elbow there. This one looks good. Can you see your nails? Okay. And looking at your legs. Good. Toenails look good. All right. All right, so now I'm going to be touching your head a lot, checking out different things, all right?
Okay.
So first thing I'm going to do is just feel around on your scalp. If you feel any tenderness, let me know. Just going to look under your hair a little bit. Okay. Looks good. Now I'm going to palpate your sinuses, okay?
Okay.
I'm going to go under here. Any tenderness there?
No.
Any tenderness here?
No.
Okay. All right, now I'm going to check your some of the facial or the cranial nerves on your face. I'm going to have you do some silly things. So close your eyes for me. Don't let me open your eyes. Good. All right, clench your jaw. Good. Puff out your cheeks. Raise up your eyebrows. And give me a smile. And frown. Okay, good. I'm going to feel all of your lymph nodes. Okay? So we got your ones that sit in front of your ear, preauricular, postauricular, occipital, your tonsillar, submandibular, submental. Got some in your neck here, superficial cervical, posterior cervical. I'm going to push kind of hard now. So deep cervical, and then the subscapular. All right, looks good. Now I'm gonna have I'm gonna test the sensation in your face. So I'm gonna use a Q-tip. All right, let me see your hand real quick. All right, so this is dull. This is sharp.
Okay.
Feel the difference?
Mm-hmm.
Okay. Close your eyes. Now tell me if you feel sharp or dull.
Okay. Sharp. Dull.
Okay.
Sharp. 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 Dull. Sharp.
Good. Now keep your eyes closed, and I'm going to touch your face with the dull end, and I want you to just point to where I'm touching.
Okay.
All right. Next, I am going to look at your mouth and then your nose.
Okay.
So I'm going to use my little light here. And tongue depressor. Okay, open your mouth for me. Stick out your tongue. Good. I'm going to push your tongue down and say ah. Good. I'm going to have to gag you a little bit. Oh, sorry. Okay. Just have to make sure that your gag reflex is intact. Okay. So look on this side. Now pick your tongue up. There you go. Okay, looks good. Get rid of that. Okay, now I'm going to look at your nose real quick. Feels good. All right, I'm going to plug one nose. I want you to sniff. Okay, now the other side. All right, I'm just going to look in your nose. Good. All right, looks good. Now I want you to close your eyes. We're going to test your sense of smell. I'm going to have you smell two different substances, and I just want you to tell me what it smells like.
Okay.
All right. So plug off one nostril for me. What do you smell?
Coffee.
Good. All right, now switch to the other one. Got something different.
Cinnamon.
Yep. Good. Okay. So, going back to some of your cranial nerves, I just need to check your spinal accessory nerves.
Okay.
So I'm going to put my hands on your shoulders. I want you to lift up. Good. All right. Now I want you to look to the right and to the left against my hands. Good. Good. Okay. And let's move on to your eyes.
Okay.
I have this little card here. It's just going to test for your near vision, make sure that you can see close up. So I'm just going to hold it about 14 inches away.
Okay.
And I want you to cover one eye and read which line you can see the clearest, these numbers.
3, 7, 4, 2, 6, 8.
All right, good. 20, 30. Now do the other eye.
8, 3, 9, 2, 5.
Wow, okay. 20, 25. So your right eye is better than your left eye.
Okay.
Now I want you to do it with both eyes and see if you can see better with both eyes.
Okay. 4, 2, 8, 3, 6, 5.
Okay, good. 20, 40. All right, I'm going to put that down. Now I just want to test your eye movements,
Okay.
your extraocular movements. So I want you to just follow my finger with your eyes. Good. Okay. Good. All right, that looks good. Now I want you to let me grab this. I'm going to use this card here, okay? So I'm going to cover one eye. I want you to focus on this tongue depressor. I'm going to cover one eye and then uncover it and do the same to the other. All right, so focus on the tongue depressor. Good. Good, no movement. All right, now we're going to test your pupils. So I'm going to be shining a bright light in your eyes, okay? All right, so just look straight ahead at me. Good. I'm just going to block one eye, okay? Good. Okay, both pupils reacted like they should. Now I'm just going to shine this bright light at your middle of your forehead. I just am looking to make sure that it's reflected in the same spot in your eyes, and it is. Okay. Okay, so we've done your eyes. Now we're going to check out your ears.
Okay.
So I'm just going to feel for any bumps or anything obvious on the outsides of your ears. You have these big gauges. And now I'm just going to look in your ear. Do you have any problems hearing?
No.
Okay. Okay. Yeah, good. Yeah. I'm just going to pull your ear back. Pull it. There, that's better. Okay, looks good. I'm going to come around to your other side now. Okay, looks good. Alright, now we're just going to test your hearing. We've got two different tests. They're called the Weber and the Rene test. So first thing I'm going to do is place this on the top of your head. I'm going to make it make noise like that. and I want you to tell me if you hear it better in your right ear, your left ear, or if it's the same in both.
Okay.
All right?
I hear it in my right.
In your right ear?
Mhm.
Okay. All right. Now I'm going to place it behind your ear. I want you to tell me if you hear it better in 1 or 2. So this is 1. This is 2.
2.
Okay. Do the same thing on this side. 1. And this is 2.
2.
Okay, good. All right. So we're almost done. I just need to check your thyroid and then listen and look at your lungs, okay?
Okay.
So I'm going to stand behind you. You just look forward. I'm going to have to kind of push your neck over to feel for your thyroid.
Okay.
Okay, swallow for me. Good. Swallow again. Good. Okay. All right, so now we're going to check out your lungs. So I'm going to have you take your shirt off for me. Okay. You do have some scoliosis.
Yeah.
We knew about that already. So I'm just going to feel on your spine. Tell me if anything feels sore. Okay?
Yeah.
All right. Now I'm just checking your chest diameter, which is about 1 to 1. Normally it's a 2 to 1. Okay. Can you take a big deep breath for me? Okay, let it out. Good. I'm just going to put my hands on the back here. Take a big deep breath. Good. Okay. Now, I want you to repeat the phrase blue moon for me every time I touch your back, okay?
Okay.
Have it move a little bit this way. Yeah, good. Okay.
Blue moon. 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 Blue moon.
Good. Okay. Now, you can leave it there because I'm going to do some percussion, okay?
Okay.
I'm just going to listen to you. I'm going to have you take a few deep breaths. If you get dizzy, just let me know.
Okay.
Okay, deep breath. Deep breath. Doing good. Just listen to the side here. The other side. Okay. Sounds good. Okay. So I just want you to take another deep breath for me so I can see the front of your chest. Rise. Okay, deep breath. Good. All right, now I'm just going to listen to the front. Deep breath. Just 2 more for me. Okay. Good. that's the end of the first part of the physical assessment. Good, stop.